going to go over various health conditions and how none of them actually qualify you just in itself. So the reason I want to talk about this is I actually spoke to someone this morning. Like I called someone this morning for one of my appointments, and he was just looking to get some information on if he qualified, and he was basically just telling me everything that's wrong with him, and then he was like waiting for me to tell him if he qualifies based on that. You know, he's like, I have high blood pressure and diabetes, and I think that's all he said that he had. And I was kind of waiting for him to say more, and he was waiting for me to tell him if he's automatically approved.
Right.
And I had to ask him a little bit more, and it turned out that he was still working. Full time too. He was working full time. And so he basically just wanted to know, like, hey, I have diabetes. Is that one of the things that qualifies me? Which is not how the program works.
Right, exactly.
So what can you tell us about how to actually qualify based on your medical condition?
Sure. I give my clients, when I'm prepping them for a hearing, I give them an example of two people who have the same diagnosis. They have the same treatment. Let's say they've got degenerative disc disease, both of them. They both have had 3 back surgeries. They're both taking, opioids for pain relief. One of them is still working. He plays softball on weekends. If anybody was to check out what he does, during his free time, he's throwing his grandchildren up in the air and catching them. And the other guy can't get out of bed. I mean, it literally, he hears his bones cracking, and just to get his feet out of the bed and on the floor is a chore. What's the difference? They both have the same diagnosis. They both have the same treatment history. Let's say that they're both the same age. But there is a difference, and it's their symptoms. Your symptoms can win your disability case. Your diagnoses never will. And a lot of people are like, what if I have, cancer? It's not a given. It's not an automatic allowance. HIV, I'm HIV positive, and it's an automatic allowance. Not anymore. It's not. And these things, as medical technology improves, these impairments that used to be automatics back then are not automatics. Diabetes is a big one. You mentioned that one. And there's 2, diabetes 1, type 1, which is usually more severe than type 2. But neither one of them are going to get you allowed. Yeah. What are your symptoms? Are you having numbness and tingling in your extremities? Are your vision going bad? Are you having highs and lows? Highs so bad that you're like in an almost manic state, or lows that where you literally fall out. Yeah. Has your treatment for diabetes gotten so bad that you have to wear a pump all the time? You got an insulin pump that's always, basically taking the place of your pancreas. Okay, that could be disabling, but it's not automatic. And so I always tell people, your diagnoses will not win your case. It's your symptoms. Yeah. What is it about your ability to function or your inability to function that makes it to where there's no way I could make it through an 8-hour workday, much less a 40-hour work week.
Right. And we do need the diagnosis as well.
Yeah, absolutely.
It's basically, if we have the diagnosis set in stone, but there are no notable symptoms, you don't have a case.
Right.
But if you only have symptoms and you've never been to the doctor,
right,
then you also don't have a case.
Right.
So I break it down and say you need the diagnosis, but then you need the symptoms that go along with the diagnosis, and then we really need to know a little bit more about how the symptoms impact your day-to-day life.
That's right.
Neuropathy is a symptom from diabetes, but tell me a little bit more about how does neuropathy prevent you from working a shift?
Right.
And usually it's trouble, walking and standing, and then if it's in your hands, trouble gripping things.
Absolutely.
And
and that's it, once again, not just in the hearing, but in the forms that the lower levels, at the initial level, at the reconsideration level, the forms that you get as a claimant are going to ask you about feeding your pets, about are you able to go to the mailbox, are you able to count change, are you able to do yard work, are you able to do normal household chores, something simple like making the bed, something more involved like doing laundry. And they ask you these things for a very specific reason. One is are you experiencing symptoms that could be expected from your diagnosis? But 2, are the symptoms so severe that you can't do these things that would translate into problems in the workplace.
Yeah, I mean, like we were talking about earlier, we don't live in a healthy country.
Right.
And when you get to the age of your 40s, but especially in your 50s and your 60s, everyone has a chronic disease.
Sure.
Everyone has diabetes or pre-diabetes, high blood pressure, arthritis at some point, or in some point in your body. And I remember when I worked in retail, I worked with multiple people that had high blood pressure and diabetes and obesity and certain kinds of cancer, and they were working full time.
Sure.
And so, I mean, just to your point, sometimes some people will have the exact same diagnosis, and it's just simply not disabling.
I'll give you an example. When I still worked for the government and doing disability, we had an employee in our office, and she was a triple amputee. So she,
Oh, wow.
yeah, triple. And she's working full time. But the day she stopped working, she could apply and get approved for disability. She had what they call a listings level severity. Now, we've talked about diagnoses, and it's true that a diagnosis will not always win your disability case, but there are some diagnoses that do. You know, metastatic cancers in and of themselves won't. Metastatic cancers, and that just means cancers that have spread beyond the region they're at, like a lung cancer into the pleura, which is the sac around your lungs. Probably not going to allow your case. Lung cancer spread to the liver, spread to the brain. That's you're still going to need the medical records. You don't really need to be telling anybody that you're having difficulties walking and getting around, because those kinds of really terminal diagnoses speak for themselves. But for the most part, I mean, you got to have some symptoms that are disabling.
Yeah.
That limit you in just what you can do day to day to day.
Yeah. It's, one of the reasons that I wanted to start doing this podcast is because when I'm talking to someone one-on-one about their situation, it's very hard for me to be forceful and matter-of-fact without it sounding like it's coming across personal.
Sure.
In this podcast, we can be as forceful as possible.
That's right.
Because we can.
Not mentioning any names.
Yeah, it's like, this is just how it is, period.
But this is based on real world. I had several hearings this past week, and I can talk about them without mentioning any names, and talk about the things that were great in that hearing and the things that my client did that were just really, really demonstrative of somebody who's disabled, and things that they said and they did is like, that doesn't help your case at all. In fact, it probably hurts your case. So yeah. But yeah, that's I think that's why we're here, just to kind of this is going to resonate with somebody out there who's going through the process, and say, okay, now I understand why. If you went to a representative and you said, well, I have this and I have this and I have this and I have this, and they said, I can't help you, and you just think that they're a jerk, or you think that they're not taking your impairment seriously and they just brush you off. Well, they probably took them very seriously, but they realize that Social Security requires that there's some kind of limitation. And the vast majority of the time, that limitation has to be a symptom, not your diagnosis.
Yeah. I think a lot of people need to learn that Social Security disability, it's specifically relating to work. And so it's tough to tell someone that, I understand that you're in a lot of pain when you're working. I understand it's hard for you to walk and stand when you're working, but you're working.
Right.
So you're not actually eligible for Social Security disability if you're still able to work full time, because the whole definition of the program for eligibility is you have this thing wrong with you that's preventing you from working.
That's right.
And so, someone is telling me about their condition and they're saying, well, I have to work, It's like, I don't want to work, I'm in a lot of pain, but I have to work. I don't have a great answer for that, but that's just how the program is.
Right, and it is so tough because you have other programs up there. They're not competing programs, but they're programs that you think, hey, it's the VA, it's a government program. Workers' comp, it's a government sponsored program. And some of my private insurance programs, they all say that, because I have this difficulty with my shoulder and I also have difficulty with my left leg, I'm 60% disabled. Social Security, you are completely disabled or you're not disabled.
Mhm.
There is no middle ground. There's no gray area. You either are or you aren't. There is a process that all adjudicators with Social Security must go through, whether at the lower levels, the disability claims examiners who handle your case at the initial and the reconsideration level, all the way up through the judges, that they have to look at a case, and it's called sequential evaluation. The very first thing they look at, are you gainfully employed? That's the first thing they look at. If you are gainfully employed, and like my colleague from many, many years ago, she was gainfully employed, but if she wasn't gainfully employed, she would have met a listing and would have been approved like that. But she was not disabled under the law because she was working. That's the first thing they look at.
Yep.
And then they start looking at severity of impairments. And someday at a later podcast we'll probably go through a sequential evaluation, because it's good for people to know that that's how Social Security has to rate your case.
Yep.
They can't just willy-nilly make some kind of arbitrary decision. Yeah, I guess you're disabled. It never happens that way.
Yeah, that's what I always tell clients, that, like, listen, medically, the things that you're telling me, it sounds like you have a great case. We have a lot of clients that are in your shoes, and we're working on their disability case. If you don't technically qualify, then they won't even look at the medical condition.
They'll never get there.
Or if they somehow get there and then they approve you medically and they find out that you were working full time, then they still deny you.
Yeah,
you get an approval and then you get a denial.
And something you just said, it reminded me of the worst feeling that as a representative you can have, and that's that you have a great case medically. It's just absolutely tight as a drum. Their doctors have weighed in, Mr. Smith, there's no way that he could do it. And you're like, oh, we got everything we need. And then, 3 weeks before the hearing, you're looking at the case record, and Social Security has ordered a new query, and they do these earnings queries, and they do them, kind of randomly, but they appear in your case file, and they're usually like 6 to 9 months late. So if you did something 9 months ago, it's probably just now going to show up. But if you did something 3 months ago, it ain't going to show up. You won't know. And so they'll run a query, and I'll be looking at the case, I'll be reviewing it, and I'm like, call them up, hey, are you working? Well, yeah. Are you working full time? Yeah. Well, it shows that you made $24,000 in this quarter, which is about $8,000 a month. Are you making $8,000 a month? Well, Carl, I had to do something. That is the phrase, that is the death knell of your disability case. Yeah. I had to do something. Let's just be clear here. Disability is not for people who, if they had to do something, they could. Mm-hmm. Disability is for, if they had to do something, they can't.
Yeah, because they're disabled.
That's disability. And like I said, it's the worst thing that we hear, and it happens a few times a year. It's like you're reviewing this. I see these earnings, and they're high earnings. Are you working? Well, I had to do something.
Yeah.
Okay. There's no way you can look a judge in the eye and get around the fact that they're not going to make it to your medical conditions. You just told them I had to do something, and so I did it. It's like, well, welcome to life.
Yeah.
I mean, everybody does that in pretty much every day-to-day activity. I had to do it, so I did it. Disabled people, I had to do it, but I couldn't.
Yeah.
I can't do it. My body or my mind will not let me do it. That's what a disabled person would say.
Yeah. Well, I mean, just try to talk yourself out of this logically. It's, I am so disabled that I cannot work, but I'm still working.
Yeah.
There's no, because the judge could ask you that in a different phrase, and you can ask the client that, and they're going to give you some kind of answer, but it's not going to make any sense.
Yeah.
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 I mean, that's the hardest thing with the clients that I speak to, is that they're still working.
Sure.
They're still working, or they're trying to go back to work, like they have an interview.
And I get that. I get that
course.
they're trying to weigh their options. I'm a lot of time. I call it paying the piper. They're working full time, but the way that their life looks is this: they work their 8-hour shift, and then they come home and they collapse. They literally can't do anything. They don't have much of a life because their body, they're having to pay the piper with their body, or they're having to pay the piper that, they're so stressed out just to get back to kind of a status quo, ground zero mentality that they can just function. It takes them hours. So they're working for hours, and then their body tells them a few hours after that it's going to take a while to get you back, and then the next day they do the same thing. And I get that. I absolutely get that. But if the next day you're doing it, I can't prove you're disabled. I cannot make that argument and win, because it'll never get to even talking about your medical conditions.
Yeah.
Are you gainfully employed? Well, yeah, I had to do something, or I have to do something. There's no point in us even talking about your conditions if you're working full time. Just can't do it.
Yeah. And to be very clear, if you're working, that's great. We want you to work.
Right.
Want you. I think that people should continue working if they're able to do that. You will never hear us. No client will ever hear us say, "You need to stop working
Right,
so that
exactly.
you qualify." And if you have a representative that tells you stop working so that you qualify, you should reconsider working with that representative.
We get those calls. I don't know if it's hundreds of times a year, but definitely dozens of times a year. We get that call that my Uncle Jerry, he has this job, and it's 40 hours, and and he can pay me like $16 an hour. I don't want to mess up my case. What do you think I should do?
It's like,
get with Uncle Jerry and try to do the job.
Mm-hmm.
And the kicker is this, folks: if you do it and it all works out for you, you've won, because you're working. You're gainfully employed and you're working. However, if you do it for a period of time, usually a shorter period of time, 90 days or so, but if you do it and after 2.5 months, you're paying the piper so bad that your wife's threatening to leave you. I don't care about your Uncle Jerry. You are miserable, and I'm sick of having to take you to the doctor once a week, and I'm sick of you popping pills. And if it doesn't work out and you can't do it anymore, you just simply can't. It's one of those situations where, I know the guy who owns the company, but I can't even go do it. I can make an absolutely brilliant argument that you're disabled. You tried, you failed. That's disability.
of course.
That's disability. So you're exactly right. Every single person who has ever come to me in the 21 years I've been doing this and said, "Carl, I don't want to mess up my case, but I have an opportunity to possibly go back to work. What should I do?" Go back to work. Go back to work. Let me know how it goes. Keep me posted every 30, 60 days. Let me know how it goes. And if it goes great, you won. And if it doesn't go great, I have more ammunition to attack the Social Security Administration if they're making a bad decision. I have more ammunition, because I can prove just by your history that you tried and you failed, and that's what happens to disabled people.
Yeah, definitely. I mean, if you try to go back to work, the main thing that we're not going to get mad if you try to go back to work. What would upset us is if you go back to work and you don't tell us.
Don't tell us, yeah.
Or even you just lie to us.
Yeah.
We ask you, any updates? Have you tried to go back to work? No? You're just working full time at Walmart.
Yeah.
We need to know about that. We're not going to be mad, but we need to know about it.
Yeah, exactly. And it happens all the time. It's one of the things that I realized when I first started doing this. I had worked for Social Security Disability for a decade and a half, and so I jumped ship and I started doing this. And one of the first things I realized, when people would call me up, and one of the first questions a representative will probably ask you if you call up looking for representation, is they will ask you, do you already have an attorney or a representative? That's one of the first things they'll ask you. And if you say yes, but I don't like them, and then you start giving all these reasons, that would happen to us quite a bit. And they would say, we're looking for somebody else. And I always try to encourage it, work it out with them. They've already got some skin in the game. Yeah. They already probably have looked at some medical records. Just stick with them, and and see if you can work it out. But by the way, why is it that you want to go with somebody else? If you think that, if you go with Representative A, it's going to be quicker than going with Representative B, we're all stuck under Social Security's slow as molasses movement. That's, we're all that way. If a representative, like you said, if a representative tells you that, they can go quicker than somebody else, you might want to rethink that representative. If they told you, like you said, that don't go to work, you'll mess up your case. Oh my goodness. Think about how ridiculous that is and how damaging that can be. You go in front of a judge and you say, well, Mr. Groves, I was going to try to go to work, but Mr. Groves said that it would mess up my disability case.
Oh,
well,
did he?
Yeah, Mr. Groves is sitting here like this, like, I would never say that, but if I did say that, the judge is probably going to have a good talking to with me. But that is something that you need to be aware of. That you don't want you don't want to switch representatives because of a silly reason. I think they'll go faster, or something like that. The number one reason, and this is getting to my point, the number one reason of switching a disability representative is poor communication.
Yep.
Or no communication. And it took me years and years to actually get into the weeds with Social Security law. But good communication is not something that Social Security suggests to the representative community. It's a law. You have to have good communication to your clients.
Yeah.
And like I said, when I first started and we were getting these calls, that was the number one reason. Well, I haven't heard from them in 6 months. What do you mean you haven't heard from them in 6 months?
That's ridiculous.
Yeah, I haven't even heard from my representative in 6 months. Well, call them up and give them a deadline. Tell them, if I don't hear from you by, the end of the week, close of business, I'm going to look elsewhere. Go ahead and, just kind of put that on the table and see what happens. Invariably, we'd get a call the next week. They never did call us back. I instituted a process in disability consulting that if we have no news to tell you, and again, like I said, Social Security moves so slow, there will be weeks, sometimes even months, when I don't have any news to give you. I'm sitting here and I'm in the same boat that you're in. I'm waiting. Yeah, I'm waiting for Social Security to get off their and work your case, and I'm prodding them, but they're just going to move at the pace they always move at. However, I'm going to call my client every 30, 45. Sometimes we'll wait till 60 days, but usually 30 to 45 days, you're going to hear from me, and it's going to be one of those conversations that you're going to appreciate, but at the end of the day, I'm not giving you any new news. I'm just saying, I haven't forgotten about you. We're sitting on our hands just waiting for Social Security to do something, but we're not sitting on our hands doing nothing. Your case, we're still trying to prod them. Let's get some movement on this case. This man or this woman, they've been waiting for a long time. Let's do that. And we just communicate. It's not something that I hope my employees do. It's a mandate.
Yeah.
Our computer system, our case management software, it pops up. If it's been 30, 45 days since we talked to somebody, it pops up and they're, I need to call them and just check in with them.
Yep.
Usually we'll also want to check in with you, not just to tell you what's going on or what isn't quite going on with your case, but we want to check in with you. How are you doing? Are you taking the same kind of medications? Have you been to Dr. So-and-so, since we last talked? Give me an idea how you're going. And we actually document all that. And when we do that, once again, it gives me ammunition where I'm making an argument to Social Security. Well, listen, I talked to Mr. Smith about 8 times in the last 6 months, and he told me that his dosages of his medication, they just keep up and up. It gives me information that I can use to win the case. So, good communication. It's a mandate it's a mandate from Social Security. But in my company, we're going to call you even if we got nothing to tell you.
Yeah. Yeah, I think clear communication and honesty as well on the representative side and the client side.
Sure.
It's gonna give you the best chance of approval if you actually qualify for the program. You know, if you need to be really honest with your doctors about everything you have going on. You need to be honest with your representative about if you try to go back to work. You know, if you're applying for jobs, if you've lost insurance, if you've gained insurance and you start seeing someone new, that's going to be just the best chance that you have of winning your case.
Absolutely, yeah. It's just imperative. You know, when we were talking a minute ago about, you know, your heart sinks when you find out that they're working and they just didn't share it with you. There's so much that we can do if you do go back to work, because I think you touched on it earlier that, you know, the definition of disability is you have to be unable to do any type of work in the national economy for 12 consecutive months, or be expected
Yep.
to not be able to work, or have a condition that is expected to result in death. That's just Social Security's definition of disability. So let's say that you come to me and you tell me those words that make my heart sink. Well, I had to do something. Yeah, I'm working full time. Yeah, I had to do something. And I look at your case and you stopped working in 2022 and you started back early in 2025. Okay. You've met the durational requirement. That 12 months is met. And we could actually argue for disability in what they call a closed period. That is, you're not going to get a monthly check, you know, into the future. You're working. However, for that period of time that you were out of work, that you were legitimately not working, I can make an argument for that period, and we do it all the time. And it's what happens is you'll get a chunk of change. You'll get a lot of back pay for however much time you were out, and if Social Security finds that you were disabled in that period. And but you're just not going to get ongoing checks like you would if you're found disabled, and it continues. And you'd get that medical coverage if you qualified for it. There are some durational requirements there, but if you qualified for medical coverage during that period, you would get that. And so if you had, you know, bill collectors, you know, calling you, you could turn that over to Medicaid, or possibly you could turn it over to Medicare and ask them, you know, hey, I was disabled during this period, and quite likely get those kinds of medical charges taken care of.
Yeah, I mean, not all the time, but oftentimes I think the medical coverage is actually the most significant part of winning your case.
Absolutely.
Yeah, I mean, the monthly benefit is obviously helpful, the back pay is obviously helpful, but going from having self-pay or no insurance and you're really struggling to even go to a health department to having Medicare, that's a big difference.
Yeah, it's when I'd been doing this for about 6 months, a lot of my friends were like, you know, do you get teased a lot by other people that you're helping people who just want to check? And I'm like, yeah, I've gotten teased by people like that. In fact, you asking me that question is kind of teasing me, wouldn't you think? And they're like, well, isn't that what they're going after? No. Has there been a time in my past when I thought that that's what it was about or what they wanted? Yeah. Of course, sure. Yeah. When I worked for disability, I mean, they're calling all the time because they want that check. They're calling all the time because they want that check. And then I jumped ship and I started doing what I'm doing now, and I'm representing people, and they would call me all the time. You know, I really need that medical coverage. I really need, you know, Medicaid to kick in. I really need Medicare to kick in. And I'm like,
can't afford my insulin.
Getting a check is going to help them, and that, you know, it's silly to say that that's not part of it, but I found out very quickly, like within the first 5 or 6 months that I was doing this, they're really interested in having medical coverage. Yeah. And when you realize that, you're like, that's the way a disabled person would feel.
Exactly. Yeah. I mean, I get a lot of comments on the ads that we run. I usually don't speak to the people about this because if they fill it out the form, they're pretty serious. But right. I get comments all the time or I see comments all the time on our ads. It's like, you're just helping people that want free money, or these people just need to go back to work. And you got to think, if someone's not actually disabled, we don't want the case.
Right.
We're not going to help someone if they're not actually disabled and we don't believe that they're disabled.
Right.
Because, they could ask for our help, but look, we're not going to get paid unless we win the case. And we don't really think that we should help you unless you qualify. And so those people are out there, but, they're not working with us.
Right. Yeah, and there are people usually there are people in our locality, where we have a couple offices that are on each side of a pretty large city. So we get some walk-in people or walk-in clients or claimants that come in and they're like, "Will you take my case?" And more times than not, no.
Yeah.
No, I can't take your case. I don't think I can win your case. There's you got so many things working against you. They come in and they're like, well, I haven't seen anybody in a couple of years, but I don't think I can win your case.
Yeah.
And it's, I think when they walk through the door, they're thinking, okay, well, you're going to want to sign me because you're going to be able to make a fee out of winning my case. Well, that's true. I do get a fee if I win your case, but I got to win your case.
Yeah,
and if you haven't had any treatment in 2 years, or there are other factors that I find out in interviewing you that just I can't help you with, like you said, sometimes being perfectly frank comes across as being perfectly cruel, but I think it's in your best interest if I tell you you have a horrible case. There's nobody on planet Earth who's going to approve your disability case. If you think you're disabled, you need to be doing this, but you're not. You need to be doing this, but you're not. You just told me this. A disabled person would not tell me that. And let me help you.
Yep.
I'll help you by telling you the truth, even if it stings a little bit. But you're exactly right. Communication, honest communication. It's a two-way street.
Mm-hmm.
I tell my clients. A week before the hearing, I usually prep them. This is how the hearing's going to go. These are the questions you're going to get asked. And they always want to say, will you tell me, or will the judge tell me on the hearing whether I've won or not? No. It happens, but it's so rare, it's statistically not even significant for me to tell you it's going to happen.
Yeah.
So probably not. But what is going to happen is I'm going to talk to you after the hearing. May not be the same day of the hearing, but in the next day or two, you're going to get a call from me or one of my employees. And I'm going to shoot completely straight with you. I'm going to tell you that your testimony was great, if it was great. And I'm going to tell you, you said some stuff in that hearing that even though I tried to come back and cross-examine you and try to clean that up, you wouldn't let me. And I'll be completely honest with them, about how the things went. And I look at it this way. If I'm a disabled person and I've hired somebody to represent me, I want them to shoot straight with me. Once in a while it's going to sting, if you're going to tell me some criticism, but it's better than you sugarcoating anything, telling you that, the hearing went great and blah, 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 blah. And then, a couple months later you get the decision, denied. And there's this, big, long explanation why the judge thought that you were not credible and your testimony was inconsistent and all sorts of stuff like that. But I never talked to you about that. I never told you that, you said this, but then you told your doctor this. That doesn't mesh. We usually try to, cover those things before the hearing so they don't happen. But I'll shoot straight with you. Sometimes I'll, if it's, I think that it went pretty normal. There weren't any great things that happened in the hearing, but there weren't any damaging things. I'll tell you something like, hey, we're 50-50 here.
Right.
I felt we had a good argument, and you obviously told the truth, and now it's just up to the judge, and let's keep our fingers crossed.
Yeah, I think one of the things that we've done really good at our company, and I'm not entirely sure how other representative firms will handle stuff like this, but I think we've done a really good job of, if we represent a client, like if we sign them and we represent them, then we're going to help them in that way. But when I speak to leads, right, people that my appointments and everything before we figured out if we can help them or not as a representative, if they don't qualify or we're not comfortable taking the case, I'm not just going to tell them we can't help you, the end, and then hang up.
Right.
I'm going to say we can't help you because of this, and then I'm going to talk to them for a few minutes about, if you really think you have a case, you need to do this.
Right.
And that would be, it sounds like you have a great case, but you're still working. Here's kind of how this works. God forbid if it gets to the point where you're not able to work, we can help you out.
Absolutely.
Or if you already have a representative, listen, I really think that you should try to get things figured out.
Try to work it out with them.
With
That's
your
right.
current representative. If you do find yourself in a position where you no longer have a representative and you're looking for someone else, we can maybe help you. But we never recommend that you dismiss your current representative because they're going to know more than us about your case.
Yeah.
And then with medical evidence, same thing. It's like, listen, everything you told me sounds like a great case, but you haven't been to the doctor in 5 years.
Yeah.
And so go to the doctor, establish treatment with a primary care physician.
Get into treatment.
If you don't have insurance, look at free insurance, like government insurance options. If you're not
Health departments.
Yeah, if you're not eligible for that, then go to just a free clinic or health department, and then come back to us, and we'll see if we can help you out.
There are, I can say hundreds of this a year, hundreds and hundreds of clients a year that that's exactly what we told them. Well, I don't have any money. Okay, well, you got to go to health department then. I can do that? Yes, yeah. That's what they're there for. Are they going to give you, they're not going to give you any kind of opioids. I don't even know if they give you ibuprofen, but they're not going to give you a lot of treatment that you'd get if you had a treatment with a specialist or even a normal PCP, because they have a lot of restrictions, and there are always, budgetary restraints on government subsidized health departments. But there's going to be a paper trail that Mr. Smith came in and he says his back is so bad that he can't even get out of bed in the morning. Mm-hmm. Okay, and 2 months later, his back is so bad that he'll do anything. He's soaking in a tub for 2 hours in scalding water to try to get some relief.
Yeah.
Okay, those kind of records. That's a disabled person who has no insurance. That's the kind of stuff that I'm going to see. And that's the kind of stuff that makes it a lot more credible and a lot more easy for me to argue to Social Security that you couldn't make it, through a work day.
Yep. Ideally, you have a primary care physician and a specialist or multiple specialists.
Sure.
If you can't afford that, ideally you just have a primary care doctor that you see every month or two. Worst case scenario, though, just go to a health department. Go to some kind of free clinic, because we can make an argument if you have specialty treatment. We can make an argument if you see your primary care doctor, and we can make an argument if you go to a health department. We can't make an argument if you just tell us that you're disabled with no doctor intervention.
Yeah, it just doesn't work. I mean, that's, when you're a parent, you can get away with saying, because I said so. And that's the only time in your entire life that you can get away with that. Yeah, you can't get away with that in school. You should give me an A. Why? Because I said something. That ain't gonna work. In a job, I don't think I should have to come in, 5 days a week. Why is that? Because I said so. No. And then if you go in front of Social Security, you guys need to find me disabled. Why? Because I said so. You got to believe me. Yeah. It doesn't work in any other aspect of your life. It's not going to work when you're making an application for disability.
Yeah, I mean, if you think about it, obviously you and I believe that there's too much friction in the Social Security disability system, but there is an amount of friction that is necessary just to prevent bad actors.
Absolutely.
You talk about all the people that are, the comment section, it's like these people just want free money, these people aren't disabled. The people that are not disabled and really just want free money, well, think about if they could be still working, if they didn't have to wait any significant amount of time, and they didn't even have to go to a doctor, and all they had to say was, I have anxiety, therefore I should be approved. The program would get overrun with these people.
Absolutely.
So a little bit of friction weans out the people that are not actually disabled.
Sure, absolutely. And it's not easy. I tell people, even though I've done VA disability before, I don't do it now. But I have done VA disability, and I've read a gazillion workers' comp cases. Yeah. I can tell you from my experience that the hardest type of disability to be approved for is Social Security disability. Yeah. It is they require everything. You're either completely disabled or you're completely okay, and that's just the way that they look at it. And because of that, like you said, the friction in applying and the things that they make you do, it can be really, really frustrating, especially, you're telling the truth, and you're just trying to get the government to actually listen to you. They'll send you forms that they've already sent you, and you're like, why are you doing that? Well, what if the form that you sent in 2 years ago differs from the one you're sending in that they want you to send in now? You've basically, dug a hole for yourself. There's that friction. They want you to be consistent. Are you always telling me the same thing? Or in a hearing, the judge will actually say, some of the judges will actually say something like, I look at the forms you filled out 2 years ago as sworn testimony. Okay, so the stuff that
you better remember.
Right, the stuff that you say today in your hearing better mesh with the stuff that you wrote in the form that you filled out 2 years ago.
Yeah.
Doesn't have to be exact. And once again, a good representative is going to go through that with you and make sure that, I'll never tell you what to say, but I will say, 2 years ago when you filled out this form, you said, you had 2 dogs and your neighbor had to help you feed them. I mean, is that true? Yeah. You still have those 2 dogs? I do. They're fatter now. Is your neighbor still having help you feed them? Yeah. Okay. All right. So that actually meshes and stuff like that. But so we'll go through that. And if there's stuff that has changed, nothing wrong with that, because, you're not lying if things have changed. You just basically tell the judge, well, things have changed. They might have gotten worse. I could do this 2 years ago and I wrote that on a form. In no way I can do it now. Or it might have gotten better, and it's not going to be necessarily damaging to your case, because that's the way life is. Some things get a little bit better and some things get a little bit worse. But you don't want there to be such a difference that you come across looking like, okay, were you telling the truth 2 years ago and lying now, or were you lying 2 years ago and telling the truth now?
Yep.
And you don't ever want to be in that position.
Yeah, I mean, the theme of this episode, just the best way to be consistent is to just be honest.
That's
with
right.
everything you tell Social Security, everything you tell your doctors, and everything you tell your representative. Just be honest. If you're actually disabled, then just be honest. And let that
Absolutely.
kind of speak for itself.
That's exactly right.
Yeah.
I could tell my clients, your case will speak for itself.
Yeah. Nice. All right.
Good.
Well, I think that's a wrap.
All right.
Good info.